Assalamualaikum warahmatullahi wabarakatuh and good day to all. My name is Rafidah binti Ali, entomologist from Institute of Public Health, National Institute of Health, Ministry of Health, Malaysia. Today, I would like to share an interesting presentation entitled Preliminary Assessment on Malaria-Related Knowledge, Attitudes and Practices amongst Visitors at Selected Recreational Parks in Peninsular Malaysia. Recreational parks are popular among Malaysians for spending their weekend outdoor. Nevertheless, recreational parks may also serve as shelter and refuge for populations of mosquito, including Aedes species, Anopheles species, Culex species, and other species. These species are vectors for diseases such as dengue, malaria, filariasis, as well as Zika virus and other vector-borne diseases. Although no data was available to show that transmission of vector-borne diseases has taken place at recreational parks, there is a possibility that these recreational parks can be a potential area for the transmission of mosquito-borne diseases because they provide an ideal setting to become a common meeting point for human and mosquito. The fact that vector-borne diseases are responsible for 17% of the global burden of parasitic and infectious diseases causing over 1 million deaths and considerable mortality and morbidity worldwide, the transmission at any area, including potential area, should not to be taken lightly. Objective of this study is describe the knowledge, attitudes, and practices amongst visitors of recreational park with regards to malaria and its prevention. A cross-sectional survey of KAP was conducted at 3 recreational parks in Malaysia, namely Sungai Kedondong Recreational Park, Selangor, Sungai Tekala Reserve Forest, Selangor, and Cemerung Reserve Forest, Terengganu. 460 questionnaires were distributed among park visitors who are willing to participate in this study on voluntarily basis from October 2017 to March 2018. Analysis was then performed on questionnaire that are filled completely by participants. Respondent demographic were consisting of 59% male and 40% of female with the age between 18 to 64 years old. Around 73% of respondents were employed with a quite large percentage working in the private sector compared to 40% who were working in government sector. Majority of respondents knew about malaria, were as high as 77% of the respondents were found to have a good knowledge about malaria signs and symptoms. Around 79% of the respondents were aware about mosquito as a vector that transmits malaria. The sources of information were mainly television and social media. The most popular method for avoiding mosquito is using repellent, followed by the use of aerosol spray. Data also showed 62% of respondents used repellent before performing outdoor activities. This study revealed that the most popular activity carried out at this recreational park was camping. As far as seeking treatment is concerned, 88% of respondents said that they would seek treatment if they had a fever after visiting the park. Private clinic or private hospital were their preferred treatment-seeking place. 44% of respondents indicated that they would pursue medical attention within 1 to 2 days of the onset of fever. According to the statistical analysis, the respondents with tertiary education were 7 times more likely to be aware that malaria is transmitted by mosquitoes and it is a disease that can be treated compared to respondents with primary education. Respondents aged 30 years old and below are 4 times more likely to seek treatment when they have fever after outdoor activities compared to the other age groups. This study, nevertheless, able to show a pattern of good understanding among park visitors regarding malaria and its prevention. This understanding was significantly influenced by participants' level of education. Awareness programs should continue as a constant reminder for public to protect themselves from mosquito bites and get infected with malaria. Thank you and take care.